घर ठीक है उसका, तो उसके बाद उसको होम आइसोलेशन के लिए सलाह देती थी। अगर वो बीमार है, उसको कोई बीमारी ज्यादा है या कोमोर्बिडिटी है, तो उसको फिर हॉस्पिटल भेजती थी। और अगर उसके घर में स्थिति ठीक नहीं है, वहां कोई कमरा नहीं है उसके रहने के लिए, तो फिर उसको क्वारंटीन सेंटर ले जाती थी। ये पिछले फ्राइडे तक की स्थिति थी। लेकिन पिछले सैटरडे को केंद्र सरकार ने और एलजी साहब ने पहले तो होम आइसोलेशन बंद कर दिया। बोले कि हर पेशेंट को 5 दिन के लिए क्वारंटीन सेंटर जाना जरूरी होगा। फिर उनसे बात करके इस आदेश को जैसे तैसे वापस कराया। तो उसके बाद एक और आदेश दे दिया केंद्र सरकार की ओर से कि हर व्यक्ति को क्वारंटीन सेंटर जाना जरूरी होगा पॉजिटिव पाए जाने पर, भले ही उसको बाद में होम आइसोलेशन में रहने की इजाजत दे दी जाए। अब 100 डिग्री, 102 डिग्री, 103 डिग्री अगर किसी को बुखार है, वो पहले क्वारंटीन सेंटर जाएगा ये दिखाने की भाई मुझे चेक कर लो और मेरा घर देख लो मेरे पास में। तो ये कैसे हो जाएगा? ये तो उसकी तकलीफ बढ़ाने वाली बात हो गई। पहले से ही बीमार आदमी है और उसकी तकलीफ बढ़ाओ। जो आदमी ठीक भी है, उसको पता चल रहा है मुझे कोरोना है, उसको भी हम कहते थे जाओ भाई पहले क्वारंटीन सेंटर जाओ। तो इससे लोग बहुत दुखी थे। तो इसके लिए भी हमने केंद्र सरकार से निवेदन किया था। हमें खुशी है कि केंद्र सरकार ने हमारी बात मान ली। अब फिर से दिल्ली में वही सिस्टम लागू हो गया कि अगर आपको कोरोना पॉजिटिव पाया जाता है तो आप अपने घर पे रहिए, वहीं आपकी स्क्रीनिंग हो जाएगी और दिल्ली सरकार की मेडिकल टीम आपके घर पे आके आपके घर की स्थिति देखेगी, आपके शरीर की स्थिति देखेगी। अगर टेम्परेचर नहीं है, अगर कोई और ऑक्सीजन वगैरह की प्रॉब्लम नहीं है, तो आपको वहीं घर पे ही रहने की इजाजत दे देगी। और अगर हॉस्पिटल जाने की जरूरत है तो हॉस्पिटल भी आपको फिर जाने के लिए कहेगी। तो ये जो व्यवस्था बीच में लागू हुई 3-4 दिन के लिए, अब ये खत्म हो गई है। वापस होम आइसोलेशन में रहने के लिए, अगर आप होम आइसोलेशन में रहने के लिए एलिजिबल हैं, तो आप कोरोना पॉजिटिव होने के बाद भी होम आइसोलेशन में रह सकते हैं। लाइन में लगने की जरूरत नहीं है आपको, जो बीच में सिस्टम लागू हुआ था। अंत में मैं कहना चाहता हूं कि होम आइसोलेशन एक बहुत शानदार व्यवस्था है, जो दिल्ली में सारे देश में सबसे शानदार तरीके से चली है और करीब 30,000 पेशेंट्स इससे ठीक हुए हैं। तो जो व्यवस्था अच्छी तरीके से काम कर रही हो, जो शानदार तरीके से चल रही हो, उसको हमें आगे बढ़ाना चाहिए, उसको बंद नहीं करना चाहिए। लोगों को परेशानी बढ़ती है इस तरह की व्यवस्थाओं से बंद करने के लिए। तो मुझे खुशी है कि आज वापस वो फैसला ले लिया गया और केंद्र सरकार ने भी हमारी बात मान ली। और आज एसटीएमए की मीटिंग में फैसला लेके उस ऑर्डर में मैं पढ़ के सुना देता हूँ। उसमें लिख दिया गया है कि जिन लोगों के जो हमारे टेस्ट सेंटर्स हैं वहाँ टेस्ट हो रहे हैं, उनकी स्क्रीनिंग तो वहीं हो जाएगी जो रैपिड टेस्ट होते हैं। और बाकी लोगों के लिए ऑर्डर में लिख दिया गया है कि द पेशेंट शैल बी अलाउड होम आइसोलेशन इफ एज पर असेसमेंट ऑफ होम आइसोलेशन टीम सेंट बाय डिस्ट्रिक्ट सर्विलेंस ऑफिसर द पेशेंट इफ द पेशेंट इज माइल्ड या प्री-सिम्प्टोमेटिक, एसिम्प्टोमेटिक, unless he or she is having comorbid condition and has a residence of 2 rooms or a separate room and a separate toilet for the patient, he will be allowed for home isolation। मतलब अगर आपका 2 कमरे का घर है या आपके घर में आपके लिए एक सेपरेट कमरा है और सेपरेट टॉयलेट अवेलेबल है, तो फिर आपको सिम्टम्स ना होने की स्थिति में घर में ही रहना है। और होम आइसोलेशन ही कोरोना की सबसे बड़ी इलाज के रूप में सामने आई है, इसलिए ये एक अच्छी चीज है। थैंक यू।
So that's the latest brief that's coming from the Deputy Chief Minister of Delhi, Mr. Manish Sisodia. They're effectively giving out what's been decided in that crucial meet that took place between Delhi's Lieutenant Governor and the Delhi Chief Minister Arvind Kejriwal. Effectively, the LG has found reason. He's reasoned out what the Delhi government was arguing and asking for the withdrawal of mandatory clinical assessment of someone who has COVID-19, who's suffering from COVID-19. The Delhi government had argued that this is inconvenient both to the healthcare system as well as to the patient. So the LG has now rolled back that order. The health department will deploy a robust surveillance mechanism. COVID positive cases who do not have adequate facilities at home only to ensure physical segregation, do not have other medical conditions, would be required then to be shifted to COVID care centers and other facilities. So this is in the circumstance only if the patient does not have those facilities. So the Delhi government for now maintaining here that home isolation is your best bet. And if you are having mild symptoms there, you will not mandatorily be dragged out for a clinical assessment, which is what the Delhi LG office was first making compulsory. We have with us our correspondent Alok getting us these inputs here. Alok, this is the second rollback to an LG's order, what we've seen all along. Effectively, what comes clearly across is the Delhi government understands the ground situation far better than the LG's office.
Yes, sir, definitely. What we can say that the flashpoint has now come to an end, and this initially started because of the LG's order. There were two orders that came from the LG. That first was also controversial, and the second that came on Sunday. This order that came on Sunday, there are 2 points were written on it. That first is those people who are turning out to be COVID patients, they all have to go to the COVID care center for clinical assessment. So that is what the main questionable, and that is what the main objectionable point by the Delhi government. And that the second point was also written on the order was those people who are turning out to be COVID patient, the team will also go to their home, and there will be a medical access, clinical assessment will also happen to that place, and also the team will look that if those people are maintaining the social distancing or not, whether those people are living in a separate enclosure or not. So these are the 2 points that were written in the LG order. So both the things were completely not matchable, because at the same time when the person has to move to the COVID care center, at the same time the team will also go to the home. So these 2 points were very much confusing, and that is what the question of the Delhi government was, that why this kind of confusion created by the Lieutenant Governor, and this is the reason they were objecting. They were also raising points that Delhi health infrastructure is not much so healthy to in fact to give the assessment to those people who are coming to the COVID care center, because 3 to 4,000 cases are coming. So all these taking consideration of all these points, Delhi government had put the demand in front of the Delhi government, Delhi LG, and also the Home Minister. Now the intervention of the central government, now the LG has decided to withdraw his second order as well. Now only earlier facility which was already on, that those persons who are turning out to be COVID patient, and if there is no requirement of the hospitalization, the team will go to their home and they will do the clinical assessment. So now the earlier facility will be carry on, will be continue. Back to you.
All right. So Alok, what you're explaining to us here, let's clear out this confusion, this unnecessary confusion really that was created in the past few days. Let's clear it up further for people who are being faced with this situation of having someone at home suffering from COVID-19. What will be that condition that they feel that someone needs to be shifted to a COVID care center? Has that now been made entirely clear? Like, you won't be taken to task if you choose yourself that you want home isolation for your family member who's suffering from COVID.
Yes, sir. So the order was, LG's order was those persons who are COVID patient, new patients, those who are coming, they all have to go to the COVID care center. That was the order by the Lieutenant Governor. Now the Delhi government said that this order is creating confusion, because at the same time there is the team of the doctors. They are also visiting the people's house, and they are just assessing the situation, whether they are able to maintain the social distancing, whether they are living in separate enclosure, whether their houses are not in narrow lanes, whether there is the possibility of increasing the COVID threat. So all these things need to be accessed and need to be examined by the team, and that was already on in the national capital by the Delhi government. But at the same time, Delhi LG's order came, in which there was a clause happened that those who are turning out out to be COVID positive, they all have to go to the. So now the earlier process, whole assessment exercise which was going on by the Delhi government, that will be continued. Now the LG order has been withdrawn. This is the main news of this hour. Back to you.
Okay. Absolutely. So this is undoubtedly back to status quo, back to a formula which was working far more smoothly and easier for the suffering patients as well. This is what has now been decided about. LG there withdrawing its order, listening in to all the reasoning that has come in from the Delhi government. Alok, thank you for getting us those inputs. There is clarity, there has